Hi there, Frank Kuwamura from MD Spine Care. And, one of the things we're going to talk about is really healing and trauma. Um, I've had personal trauma, I'm sure you have. Um, and at MD Spine Care, we're very in tune towards not just the physicality of the injury, but how our emotions, how past trauma, how past injuries have affect us, not only at the time of the injury, but there's a lingering effect that can occur in us. And so what we try to do at MD Spine Care is understand that, look at that, and look at ways of helping you. Today we have an expert. We have an expert in the neurologic sciences, Dr. Shankar, right? And so tell me, I just got to meet you, and I was astounded. You did some things to me, and I can tell you I felt better. I mean, it was just a short little treatment, but you know
Yes.
what? You have worldwide experience in helping people overcome injuries, but from a different perspective. For us, we're taught in Western medicine, we're taught broke bone, fixed bone, bad nerve, fixed nerve, things like that. But just as we all know, there's way more than that, right? We're all more than bones and muscles and tendons and things like that. And that's how you can help us.
Absolutely, yeah. So essentially, I discovered that there is, whenever we have any kind of ailment of whatever sort that is, whether that is physical, emotional, what have you, I discovered that very often there is what people like to refer to as a root cause. So that is often something that happened at some point in our lives, and at the point where it happens, it doesn't necessarily have to be a big thing, and it doesn't necessarily have to materialize into something, but it creates that first crack in the window that then later, when even more happens, actually is a weak point, and then injuries happen faster and mental disease happens faster. So that's what I discovered, and I discovered that the brain speaks a language where you can basically tell the brain in a way, hey, this was quite some time ago, it's time to relax a little bit.
Sure. Have you noticed? I have. I know it's one of the things that I became aware of in talking to in just a short time we spent was, yeah, I started thinking back about past traumas or past little things and thinking about, well, can those things now, do I carry them forward? And honestly, yeah, I was carrying things forward.
Yeah.
And I'm looking forward to helping get rid of those things and
Yeah.
hopefully get to a better state of health.
Absolutely. So we carry them forward often on a subconscious level where our brain has actually forgotten about it because there's just so much going on, and a lot of it happens in our childhood as when we are young adults. But even though our conscious brain forgets about it, our subconscious brain has not forgotten about it. And it's very interesting that you can communicate with the subconscious brain through techniques that we borrow from the world of kinesiology, where they do muscle testing and they see how does the body react when there's a certain impulse that reminds your subconscious nervous system of that thing that happened way back.
This is amazing, and it certainly now takes us from an understanding of bodies and injuries into a different level. How did you learn about this?
I was struggling with ankylosing spondylitis, which is a very painful disease where you have constant inflammation along your spine. It travels. It can create what is referred to as a bamboo spine, which means...
That's what we're taught.
Right. So your vertebrae fuse together. In the worst case, it leads to paralysis. So I was living with that, and I kind of self-maintained with a healthy lifestyle. But I was traveling, and I was at a conference for a completely different reason. And someone was there who did a 5-minute treatment on me, similar to what you experienced when you got a try. And within those 5 minutes, 20 years worth of pain lifted. Wow. And it was just so incredible. And of
what
course,
a breakthrough.
Yeah.
Oh my gosh.
Absolutely.
Opening a door and it's like sunlight again.
Yeah. Yeah, it was incredible. It was very emotional. I had tears of joy. And like everyone who experiences something like this, my initial question was, well, what happened? Number one, is this real? And number two is, how persistent is this going to be? Is that going to be over tomorrow? And the day after that intervention, I still felt great. So I spoke to that person, a physician who lives in the UK, and I said, "What's going on here?" And he said, "If you really want to know, come and be trained in the UK." So I did that, traveled to the UK and got trained. And then I did something that I love, because there's this concept of having done something for 10,000 hours to
Sure.
really become good
That's
at it.
culturally, there's a lot of cultural beliefs that you do that.
Right.
Right.
So I thought, well, how can I get that massive amount of experience? So what I decided right then and there in the UK is that I was going to stop, because I was doing my other business activities. I was going to put everything on hold and basically go on a journey around the globe for a year and help as many people as possible.
Wow, that's amazing.
To get exposed to as many versions of ailments as possible. And throughout that time, I got exactly what I wanted. I got the experience. I got to see that people can be helped without even speaking their language. I got to see I got a lot of data points, so I could say, well, it looks like there's a very high success rate, and I got to see at what ratio people have a little bit of a setback and what people don't have a setback and all of that. So, and we've just been back 3 weeks, really. So I have just achieved.
I have to like thank my wife Danielle. Thank you, Danielle, for introducing us, because we're so excited about our collaboration together and you helping people.
Yes.
Certainly in our Center of Healing and Regeneration, I think you could be an integral portion in getting people to their goal of being healthy and being better than, that's our goal, is to help people to get better and to heal and to live a better life and a healthier life.
Yeah, I'm very excited and very grateful for the opportunity as well, because what we have here is a very, very unique situation where we can truly approach a person's health from a 360-degree perspective.
Right.
And that is very unique. I have to admit, I have never found that anywhere on the globe. So I'm really excited.
We're excited too. The concept has been a dream of mine forever, this concept of a multidiscipline in perspective. We're all creatures of perspective.
Mm-hmm.
And what I may see one way, you see a different way.
Mm-hmm.
We may agree on things, but our perspective is different. Both of us can help people in our own way.
Yeah.
And recognizing that, I think, has been some of my background and my teachings and things like that, has been open to different modalities and different thoughts of health.
Yeah. I mean, first of all, I have to commend you for having that open mind, because without that kind of open mind, certain healing is not possible.
Right.
And people look to you for healing. And if you facilitate that, that's amazing. I have just to say that when I look at my own life, I see 20 years worth of someone in pain seeking for help from medical professionals in Europe and in the US, and it can take 20 years to find a breakthrough, right? And I think it is our duty and our mission to guide people through all the options to find health. And if you facilitate that, that is absolutely amazing.
Well, as you experience in your life, the helping the people, seeing their improvement in lives, that's a lot.
Yeah, it's so satisfying, and it can be the reason to put everything on hold as
well,
I
you
did.
did that.
I did that.
You did that. And so take us through a typical visit. Like, is it usually one visit, or is it more than one visit? So tell me.
Yeah.
I know people differ in what they need, but what's an average?
Yeah. So a typical visit really starts with a conversation about what have you gone through in your life that may have been difficult.
Sure.
And what's interesting is that, the conversation doesn't necessarily focus around, let's say, for example, someone comes in and says, my shoulder hurts. Well, then, I want to know, did you have an accident or whatnot? What happened to your shoulder? But then I immediately say, now let's disconnect from this shoulder problem for a moment and think about your entire life. And let's talk a little bit about the challenges.
He did this to me. This sounds like our visit.
Well, yeah,
Yeah.
because what that creates for me is a heat map.
Sure.
So I get an idea of where the priorities are, because from what I understand, the way I have learned this is that there is a hierarchy of protective mechanisms that the nervous system creates. And you can either spend a lot of time and resources working on lower priorities, or if you get the chance to really address the root cause, as we like to say, the highest priority, very often you can clear 15, 20 ailments in one go. And that is why that conversation is so interesting to find out.
It is. Our brain affects us in so many different ways. Certainly the cognitive function, but there's so many things as you've become aware, and I've become aware over the years at the subconscious level.
Oh yeah.
Things that we don't even know is happening. It's almost like our computer has another computer underneath it, and it's processing information, processing things, and it's affecting how we live our lives, our choices we make, and things like that, and our ability to get to a better place.
Yeah.
And so that's amazing. You can tap into that and help people.
Yeah, especially because what I always get excited about most is because neither I nor the person needs to be aware about what it is really. Yes, of course, when their shoulder hurts, they will be able to tell so. But sometimes things is going on where they are not aware of it, because very often there is a tiny compensation, a tiny protective mechanism that actually is the root cause of the shoulder pain.
Sure.
To stay with the shoulder, very often, interestingly enough, the right hip is the cause for left shoulder pain, because very often there's this diagonal relationship in the skeleton. And so, but often, if the right hip doesn't hurt, then we don't know. So you can't verbalize it, but through this amazing technique that we borrow from kinesiology, we do find out. So without having to be aware, without having to verbalize it, we can address things on the physical level and also on the emotional level. It's very interesting.
Okay, now I'm going to ask you with your experience. Tell me the one patient that you remember the most and what you did for them.
Yeah, so that was during the travels in Indonesia, where I went to people who really would never be in a position to afford access to something like this. So I was walking down the street and I heard music, and the music attracted me, and out comes this woman carrying a baby, and she gestures us in because they're very hospitable.
I've been in Indonesia.
Yeah.
They're unbelievably giving people.
Exactly, unbelievably giving. Because what she wanted is she wanted us to sing together. Her son had a karaoke station, and that was her way of giving. So as we entered the home, I noticed, because I'm sure you know that you get an eye for people who have pain, you can see it right away. I noticed that she had pain in her shoulder, and I asked about it, and it turns out she couldn't lift the arm any higher than this. I don't know why, because she didn't speak English. But I gestured, sit on the chair, and we used Google Translate on the phone to just, all I needed her to understand is that I need her arm to do this technique with the muscle. And yeah, within, I want to say 15 minutes, she was able to lift her arm again without pain, and the entire family was present, the son, the husband, and we were fortunate enough also to capture this moment on camera, and you just see that gratitude and this relief. And so this is really a patient that will stand out to me forever.
Right.
And yeah, it's just very, very satisfying.
Well, it's also very affirming, right? It's affirming. Yeah, you are changing people's lives.
Yeah.
And that's what we try to do. And our motto here in our mission statement at our company is that we don't treat patients, we change people's lives.
Yeah.
So can you show some things that you would do?
Yeah, absolutely.
I need to take my jacket off or leave it on?
Yeah, you can take it off.
Okay.
And then just sit on the edge on the chair so that
You're not going to do anything crazy, are you?
No.
Okay.
Not today. And I'm going to bring up my toolkit here. So Dr. K, this is this is really the tools that I use, the tuning forks and something that is a little bit sharp, but I use a lot more. I use my hands a lot.
Sure.
So when I work, I will ask for your permission to touch your head,
Sure.
your nose quite often,
Sure.
because that gives a signal to the brain I work with, and then also your belly and your back. Is that okay?
Certainly fine.
Okay, so if you would just scoot a little bit to the edge of the chair so I can access the back.
Okay.
And then I would ask you, Dr. K, is there anything that is a little bit
Sore?
Sore?
My left shoulder.
Your left shoulder?
Yes.
And I would ask you why. Why is that the case?
I'm still recovering from an injury I had skiing a few years ago. I'm much better, but it seems to be lingering pain.
Okay. And explain that accident to me.
It was I'm an average skier, been skiing most of my life, and I had an equipment failure. Fell down, broke my shoulder, and had a partial tear of my muscle.
Okay. Did you see that accident happening? You know, sometimes we realize, oh, it's about to get ugly.
Yes,
Okay.
actually, it was when my binding failed. Time went into slow motion, right? And my kids are joking with me is, Dad, you were doing great on one ski until you had to turn. And then when I turned, I went, crashed.
Okay. And could you point with the finger where you feel
Right here.
Okay, is it a tension or is it a sharp pain?
It's a sharp pain.
It's a sharp pain. Is there a movement that brings it on a little bit more that we can use as a test?
Sure, it's that elevation this way.
Okay.
Like here, I'm fine. It's really that elevation that bothers me.
And on a scale of discomfort from 0 to 10, where would you place it right now?
It averages about a 2, but if I'm using my arms or going to the gym and working out, which I try to do, it becomes probably a 5 or 6.
Okay. And now, if you lift it, you can if there is an improvement, that you can definitely say, I feel an improvement.
Yes.
Okay. So what I will do is I will use this arm to work on you. So all I need you to do is have the arm straight and the hand is relaxed. And then when I say push, you're going to push to the ceiling ever so slightly, but only when I say push. And the goal is to have the arm parallel to the floor.
Okay.
It's not a test of strength. It is just to see how you react to it. So let's give this a try. And push. Push again. Okay. Push. Okay. Push again. Okay, so I'm going to start the treatment and I'm going to start touching different parts on your body. All right, push for me. Okay, push. 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 Okay, so I'm first going to focus on the right hand side of your body, even though the pain is there, but I've seen something here. I don't know, you might be able to feel that as well. When I say push now, push, you see there's a steady way of pushing, a steady force.
Yes.
Now I place my hand here and I ask you to push, and do you see that momentary wobble?
There's wobble.
Yeah. And that is what we're going to neutralize now, because that is not in balance, okay? So I'm going to apply a technique, push, push, push. So essentially what you are experiencing now, Dr. K, is the conversation with your nervous system, right? And you maybe speak that language because you are a doctor, but most people don't. And the great thing is we're telling the brain now to relax a little bit. And now we can have immediate proof of whether this has worked or not. Push, steady, placing my hand here, push, and steady.
Steady.
So it's already much better. And let me explain the impact of this. So you just experienced that if something touches your shoulder here, there's a momentary, let's call it weakness for lack of better terminology. Now that also means that whenever something touches your shoulder, whether that is in the gym, you're doing sports, resting in your bed, whenever something touches the shoulder, there's a very tiny momentary weakness. And that tiny momentary weakness causes muscles not to do their work.
Sure.
So something else needs to compensate. And whatever that something else is going to hurt. So now we're going to focus a little bit more on this side. Push. 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 Okay. Push. Push. All right. So I want you to look here, please. Look here. Look at me. Look here. Look at me. Okay, I want you to lift the shoulder now and see if you already feel a difference.
It feels better.
Already?
It does feel better.
Okay.
It's probably, gosh, a 1 or 2 now.
Okay. Let me do one more thing that I often know will make a difference in this situation. Relax your arm here in the elbow joint. Okay. Okay, if you would give it another try.
Even a little bit better.
No.
Yeah. Almost nothing. Yeah. It's amazing.
Well,
I'm
thank
looking
you.
forward to spending time with you and learning. I mean, you speak a language that I'm only beginning to learn about, and I'm excited to learn from you.
It's going to be amazing. I'm privileged to be here and discuss this with you
Yeah.
and learn from each other.